Hey everyone! Welcome to the Dr. Mama Minute, where Dr. Burton will share snackable bits of information based on things going on in her life, in her practice, or things being discussed in her social media channels. So sit back and prepare to be dazzled by topics that you may or may not have thought were important in your life.
Hey everyone, I'm Dr. Burton, and today I want to share a little bit more information about choking hazards in kids, because kids seem to put everything in their mouth as a way to explore them, food and other things. And when they do eat food, they seem to think that chewing is optional. I've already shared an episode called The Dirty Dozen Food Choking Hazards in Kids, and today I want parents to be aware of the most common non-food choking hazards, because they can also be very dangerous. All right, I've really got to work on my spontaneity, because it seems a little cheesy to always group my posts by topics, but that's just how my brain works. One day I'm going to jump topic from topic and finish old topics weeks later, but not today, just one day. So here it goes, part 2 of choking hazards. As an ENT surgeon who's already performed more than my fair share of emergency surgeries just to remove things from the airway of choking kids, I need to keep stressing how prevention is the best solution. In my episode about choking on food, I shared some great tips for parents about what they need to do to teach kids about proper eating habits, the need to cut food into smaller pieces. So if you've not heard or read that post yet, now might be a good time. So besides food, there are many other items kids can choke on. Once choking in kids became an obvious public health crisis, steps were taken to help prevent these accidents. So in 1994, that was the year my second child was born. Maybe they were trying to help me out? Possibly. But anyway, in 1994, Congress passed laws that stopped manufacturers from marketing toys with small pieces to kids under age 3. And taking it a step further, if the toy is meant for an older child who might have a younger sibling, the product also had to be marked with a warning label. These laws have saved many lives. Now, it's important to note that these are only American laws. Other countries do not have these laws, and parents need to be aware that unsuspecting dangers may occur when they're on vacation. For instance, I remember back in the day there were lots of candies that had small toys inside of them. This no longer happens in the U.S. because kids would gobble up the candy and choke on the toy. But please remember, other countries still have little hidden treasures buried inside of sweet treats. One obvious exception in the United States that comes to mind is the Mardi Gras king cake. That contains that little plastic toy baby. And since the cake is meant for adults, it's assumed that adults will chew and spit out the toy. But parents share that cake with their kids, and they need to monitor for choking. Yes, there's lots of warning labels on those cakes, but choking still happens. Now, because I focus on airway and breathing, of course I always talk about choking, but many kids swallow objects that do not cause trouble breathing. Depending upon the age and the size of the child, swallowing objects in these kids can still end up needing emergency treatments. Dr. Kristen Stuppy is an experienced pediatrician who wrote an awesome blog post titled, "My Child Swallowed... And this post shares a really detailed, extensive discussion on this topic. I added a link to her post in my show notes. Many times, kids can be evaluated for these objects at an urgent care center where an x-ray may be taken. Based on the location and size of the object, the child may need to be referred to an emergency room where they'll have a consult with a physician specialist. Could be ENT or GI or pulmonary or general surgery, since all of us remove things that get stuck inside of kids. Just depends where and what it is and what the symptoms are. Removing these objects is always done in the operating room, and this can be arranged from the emergency room. Please remember, if you're going to an urgent care, to always call before you go to make sure they evaluate and treat the kind of problem you're coming in for. All urgent care centers are not the same. And remember that the swallowing tube runs right behind the breathing tube. So trouble breathing may happen later after a swallowed object pushes forward and the breathing tube is narrowed. Because kids like to put lots of things in their mouth that doesn't belong there, choking on things is always something parents need to try to prevent. And of course, I always emphasize all parents need to know how to do CPR. But have you heard of the Heimlich maneuver? Well, this is a move that's needed to help remove an object that is stuck in the throat. It's part of CPR training, but specifically deals with getting the airway open so that the heart and lung are not impacted. I added a video in my show notes that demonstrates how the Heimlich maneuver is performed in kids. It's very different than what's done in an adult. Everyone imagines that adult choking on food at a restaurant. You run up behind them, put your arms around their belly and push. That is not how it's done in kids, so check out the video. But remember, the best CPR is to never need to perform CPR in the first place. Close supervision and removing risky objects is a great way to avoid an emergency in a child. So what are some of these common non-food choking hazards in kids that parents need to monitor? Well, just to show you how matchy-matchy I am and how lack of spontaneous I can be, I'm now going to list 12 non-food choking hazards just to match my dirty dozen food choking hazards. In no particular order, these are the things parents need to be aware of. Number 1, small batteries. Like the little round ones in watches and hearing aids, toys sometimes come with these small lithium batteries. Not only are these batteries dangerous for a choking hazard, but because of the acid, they can cause erosion, bleeding, and sometimes death. Batteries are a significant safety hazard, and parents need to monitor them because a lot of times kids are playing with electronics and they're not aware. Kids know how to open up and remove these batteries. Safety pins. Who still uses these? I have them everywhere. Safety pins are often misplaced, forgotten where you put them. These are small enough to get lodged in the esophagus. Of course, they can be inhaled, but sometimes they open up, and if they're unhinged, the sharp part of that needle can poke into the esophagus, cause bleeding and other complications. Put your safety pins away. Legos and other small toys. This is kind of the biggest category because small toys can pretty much be everything. A toy that is made small, a piece that's broken off, but toddler-sized Legos are big. But often if you have an older child, you have those itty-bitty, intricate little pieces for making more complex designs, but those are the ones, colorful hard plastics, that toddlers will grab and swallow. Same goes for other toys that have removable pieces. Haven't seen these in a while, but like back in the day, my brothers had little toy cars. The rubber wheels can come off. Just think of every toy in your home. There are lots and lots of little pieces. After you're done playing with the toy, make sure you pick up all those pieces because trust me, they are swallowed, they are inhaled, they're choking hazards. What about balloons? What kid doesn't like to play with balloons? And of course, they are the classic party decoration. But did you know that they're a huge choking risk? A deflated balloon is easy to swallow, and if it's inhaled, it can coat the lining of the airway and stop breathing. Make sure you always monitor your kids when they're playing with balloons, since they may pop them and you don't know that a little piece has just been inhaled. It's also a good idea whenever the party's over, when there's extra balloons floating around, pop them and throw them away so your child doesn't accidentally choke or inhale on one. Pen caps. Okay, so a lot of times we have pens and the tops fall off. I can't tell you how many times I have pens floating around with no cap and ink is getting everywhere. But toddlers, they're very quick to find them. They can be around the house, in the cushion of the couch, in the back of the car. Might be a good idea to use the click pens if you've got some toddlers. Jewelry, what a huge topic. Jewelry is small and shiny and seemingly irresistible to toddlers and babies. Notice their fascination with mom's dangling earring. Often jewelry is placed within reach on a nightstand. Yeah, I know, I pull mine off and put it on the nightstand as well. But if you've got that toddler, at least open the drawer, put it in the drawer of the bedside table, or put it up higher on your dresser. Also on the topic of jewelry, I see toddlers wearing more and more of their own jewelry, dangling necklaces, and they sleep in it. Well, not only is this a risk of strangling your child around their neck at night, but it also often has a pendant, a little cross or a heart or whatever it is. Well, guess what? Those pendants, when kids start sucking on them, they come off, and indeed, swallowed and choked on. Same goes true with kids dangling earrings. I'm just here to point out that I have removed jewelry from kids' ears, inside their nose, as well as stuck in their esophagus or inhaled into their windpipe. Might be a good idea to get into the habit of checking your kids' jewelry every night. Check those earrings. Make sure they're on tight. They're not missing. I get it. My girls had pierced ears during early infancy, and I only used the earrings that had screw-on backs, but they still got loose. They still came out. Check and be aware. And if you're using bigger earrings, this can be a bigger choking hazard. Marbles. Do kids even play with these anymore? We had bags and bags of these growing up in my house, and eventually they're swallowed, usually not inhaled, but if they're swallowed, they can push onto the airway. A big concern with marbles is to kids these little shiny, colorful objects look like candy. Heck, many things look like candy to toddlers. Check out my show notes where I put a photo of a few bags of candy and a bag of the laundry Tide Pods. One of my fellow physicians went on vacation and she shared in her personal belongings what these bags of candy looked like next to the Tide Pods. And when you see it, you'll understand why kids are accidentally eating these things. All right, what about small rocks? Do you have gravel at home? For whatever reason, kids will go out exploring and in the middle of exploring, pick up the rocks. Make sure you're monitoring your toddler. Small game board pieces, played Monopoly, Sorry, colorful plastic objects. Yep, right into the mouth. Watch your child playing those games. Refrigerator magnets. I loved having alphabet magnets on my refrigerator. My kids used them to spell words. But if you have cute, shiny, round, colorful magnets, yep, they look like candy stuck on the refrigerator. Make sure if you use those, put those higher up on the refrigerator so the kid's not going to pull it off and eat it. Coins. Classically, this is a penny, but also dimes and nickels. Usually they're simply swallowed and they pass through the body. There's nothing like straining your child's poop to make sure the coin does come out. One of my first published papers was about a child who had a chronic cough, and during surgery, I found a penny that had been swallowed years ago, but it had stayed stuck in the esophagus and everyone assumed that it had passed. But instead, it had slowly eroded forward and into the windpipe. Swallowing coins is not always a simple thing. Make sure it leaves the body and it's not there slowly waiting to cause a bigger problem. And now my last group of objects that I want parents to monitor for choking hazards includes rubber bands, small barrettes, and hair bows. Kids wear lots of hair decorations and they often pull them off and immediately put them into their mouths. So try using bigger size hair accessories in toddlers. Rubber bands and small barrettes, they can be dangerous. Bottom line, toddlers can put anything into their mouths, and when it gets stuck, it can cause swallowing and breathing trouble. By being aware and using some of the preventative strategies I just shared, avoidance could be possible. In fact, in the show notes, I included some useful tips shared by the CDC. One of my favorite links that I added in the resource section is something that was called the Safety First Small Object Choking Tester. This was not around when my kids were young, but it's actually something that I saw on Amazon that allows parents to put little toy pieces into this object so it can let you know if the toy or part of the toy is too small for toddlers to use. I hope this was helpful to you, but my minutes are now up and it's time for you to get back to living your best life. Until the next time.
Thanks for listening to the Dr. Mama Minute. Now you can go back to living your best life.